Welcome back to GMP Scenario, presented by PharmaContentLabs.com.
Let's talk about a procedural shortcut that happens all the time in regulated industries. You know, it feels efficient. It feels like you're getting things done, but it's actually one of the most critical mistakes you can make, closing out a deviation without a proper impact assessment. I mean, you know the routine, right? A deviation gets filed, you do the investigation, you put a corrective action in place, and boom, you check the box, the cap is done, the batch gets released, and the deviation is closed. It feels good. It feels finished. But is it really? What if that satisfying feeling of done is actually masking a massive failure? A hole in your process so big it pretty much invalidates the entire thing. And that's where we get to the idea of a flawed closure. See, on the surface, everything looks totally fine. The paperwork is filed, but the moment an auditor looks closer, they'll see there's no decision trail. You close the loop, sure, but you never documented why it was okay to close it. And that right there is a huge problem. So what's at the heart of this failure? Well, it all boils down to one simple, absolutely critical question that never got formally asked or answered. And not one little oversight is enough to make the whole process fall apart. That missing piece of the puzzle? It's the impact assessment. And the key words here are formal and documenting. This isn't just about someone taking a quick look and saying, yeah, it looks fine. No, this is a fundamental requirement of good manufacturing practices. It's GMP 101. So when you skip that formal assessment, you're essentially ignoring the most important question of all. Okay, so what did this deviation actually do to the product? Without a documented answer to that question, your closure is basically built on nothing. And you can really see the difference here. On the left, you've got a solid, successful closure. QA has documented the impact, and every single decision is backed up with real evidence. But on the right, that's the failure. No documented assessment means the entire closure, and even the batch release, is just hanging out there with zero support. And believe me, this isn't just a little paperwork error. Taking this one shortcut kicks off a massive domino effect. It's a single point of failure that ripples through your entire system and has some pretty serious consequences. So, domino number one, you can't justify the product's disposition. You might think the batch was okay to release, you might feel it in your gut, but you have absolutely no documented scientific proof. Your decision is just an opinion, and opinions don't hold up in an audit. Which leads to the next domino, and this one's a biggie. You can't defend the batch release. That product might already be out on the market with patients, but you have no defensible record that explains why you thought it was safe and effective to begin with, especially after a known deviation. And here's the final, biggest domino to fall. When an inspector sees this, they don't just see a mistake. They see a fundamental loss of control over your own process. And that phrase, loss of control, that's a major red flag that can lead to some really serious regulatory trouble. Okay, so that's the bad news. The good news? If you realize this is happening in your system, it is fixable. There's a clear path back to compliance. You just have to be willing to reopen the case and do the work that was missed. The path is actually pretty straightforward. First things first, you have to formally reopen that original deviation. No shortcuts. Then, step 2, you do the work. You conduct a systematic, thorough impact assessment. And finally, step 3, you document everything. The rationale, the decision, and all the evidence that backs it up. And when we say a systematic assessment, what are we talking about? Well, you've got to look at the impact from all angles. What was the impact on the product itself? Is there any possible risk to the patient? Did this screw up our process or our data integrity? And the big one, does this put us at risk for a recall? Your documentation has to be rock solid too. We're talking a formal worksheet for the assessment, a list of all the evidence you looked at, the final signed-off decision, and a clear determination on whether any authorities need to be notified. This whole package becomes your official defensible record. And that really gets us to the whole point of this. This isn't just about filling out forms. It's about building a defense. It's about creating a record so clear, so logical, and so well supported that it's basically inspector-proof. You know, the single worst thing you can do, and you see it all the time, is this. Someone just writes no impact on the line and moves on. Look, without any evidence to back it up, those two words are completely meaningless. In fact, they're worse than meaningless. They're an admission that you didn't do the assessment. And you better believe inspectors are trained to look for this. It's one of the first things they'll check. They'll pull your deviation files, go straight to the disposition, and see if that no impact claim is just hanging there, or if it's supported by actual work. They always check. At the end of the day, it all comes down to this one simple principle. Your final disposition decision absolutely must be defensible. Every single choice you make about a product has to be backed up by a clear, logical, evidence-based argument. Period. So, I'll leave you with this question to think about for your own processes. When an auditor pulls one of your closed deviations, what are they going to find? Are they going to find a strong, well-documented defense? Or are they going to find a liability just waiting to explode?
Thank you for watching. If this helped, like and subscribe. More GMP scenarios coming.